Call the subcommittee back to order. Good afternoon. I'd like to welcome Keith Hall, Director of the Congressional Budget Office, back to the committee. Mr. Hall, welcome.
Thank you.
Created in the Congressional Budget Act of 1974, that infamous bill, the Congressional Budget Office produces independent analysis of budgetary and economic issues in support of the congressional budget process. Each year, CBO produces hundreds of formal cost estimates, thousands of preliminary cost estimates, and dozens of analytic reports and papers, releases numerous economic projections, and is a constant source of advice relating to budgetary issues for members and staff. Last year, I had the opportunity to visit with Director Hall and tour CBO's offices personally, and during that tour, it became clear to me just how committed the CBO staff is to their mission. You could feel the energy and enthusiasm throughout the office. CBO's fiscal year 2019 budget request is $50.7 million, which represents a 1.6% increase from previously enacted levels. In reviewing your budget justification, this year, CBO focuses on three key areas: responsiveness to Congress, increased transparency, and expanding analytical capacity. I'm supportive of all three of these areas and increased transparency, and I look forward to hearing more about your plans to improve in each area during your testimony and the question and answer that will follow. I'd now like to yield to the great Ohioan, my friend, Mr. Tim Ryan.
Thank you, Mr. Chairman. I'll keep my remarks brief. I want to thank Director Hall for being here today and highlighting for the members of our subcommittee the important work of the Congressional Budget Office. As we've learned since 1975, you've been providing independent analysis of congressional legislation. We certainly do appreciate that. These men and women are consummate professionals who, let's be honest, sometimes frustrate both sides of the aisle with their analysis of legislation we would like to see signed into law, but their work is essential to the operation of Congress. And I've seen that on both sides over the last 16 years of both sides being upset. Today, with the ongoing war on facts, science, and expertise, your job is even that much more important. CBO's analysis is a key part of pushing us towards fiscal discipline and transparency. Members of Congress need to know the economic effects of the bills before we vote, and the public needs to know how those economic effects were estimated. That's why I'm pleased to see the CBO focus on the need for responsiveness to Congress as well as transparency in their fiscal year 19 budget request. I'll save the rest of what I have to say for questions. I yield back.
Thank you, Mr. Ryan. Mr. Hall, your complete statement will be made part of the official congressional record. Feel free to summarize your remarks at this time.
Great. Chairman Yoder, Ranking Member Ryan, and members of the subcommittee, thank you for the opportunity to present the Congressional Budget Office's budget request. CBO is asking for appropriations of $50.7 million for fiscal year 2019. That amount represents an increase of $800,000 or 1.6% from the $49.9 million provided to CBO for 2018. Of the total amount, nearly 91% would be used for personnel costs. Increases of $2.6 million for three priorities: to pay for current staffing, to bolster responsiveness and transparency, and to expand analytical capability, would be significantly offset by one-time savings of $1.8 million from this year. With the requested funding, CBO would be able to add 13 new employees to augment its capabilities. To fund the current staffing levels in 2019, CBO requests an increase of $1.2 million. That amount would be used for a small increase in employees' average salary and benefits to keep pace with inflation. If such funding is not provided, CBO will need to shrink its staff and consequently provide less information and analysis to Congress in 2019. CBO also proposes to hire 20 new staff members by 2021 to bolster its responsiveness and transparency. In 2019, the agency would hire 10 of those new employees at a total cost of $1 million, mainly for salary and benefits. The agency has shifted resources already to undertake such activities and has plans for further shifts, but many initiatives of great interest to Congress could be undertaken only with more employees. Also, with additional resources, CBO would be able to pursue three main strategies to produce cost estimates more quickly. First, the agency would hire more assistant analysts who could move from one topic to another and provide support to more senior analysts when demand surged for analysis of a particular topic, such as healthcare, natural resources, or banking. Second, CBO would hire analysts to develop deeper expertise in certain topics, such as cybersecurity and higher education policy, so that the agency was better positioned to analyze new proposals in those areas. Third, the agency would hire analysts to expand its use of team approaches, in which work on large and complicated proposals is shared. With respect to transparency, CBO is actively exploring ways to provide additional information about its modeling that would be useful to Congress. The agency has released new publications this year describing its processes for producing economic forecasts, budget baselines, and cost estimates. Key staff are making presentations to congressional staff about those processes, and in the coming months, efforts to bolster transparency will include the following: publishing detailed information about key aspects of CBO's updated model for simulating health insurance coverage, including computer code, and about how analysts use the model in preparing estimates. Developing a version of CBO's model for projecting spending on discretionary programs to allow for replicating roughly 40% of the agency's formal cost estimates. Releasing technical documentation and computer code explaining how key parts of CBO's long-term budget model work and how they combine to the agency's analysis. Providing information online that enables users to examine how a large variety of changes in baseline economic projections can affect projections of the federal budget. And last but not least, posting on an agency's website a tool for examining the costs of different military force structures. Added resources would also allow CBO to produce other kinds of information that would aid transparency. For instance, CBO could provide more information about the basis for key parameters that underlie the results of models. Additional funding would also help the agency turn its internal comparisons of projections and actual results for the economy, revenues and spending, deficits and debt into public documents. Expanding analytical capacity. CBO proposes to expand its analytical capacity primarily by adding 3 new healthcare analysts in 2019. The total cost would be $400,000. Congressional interests remain high in modifying or replacing the Affordable Care Act and changing Medicare and Medicaid, and the new analysts would help the agency examine new approaches to do so. The increases for the 3 priorities are offset by $1.8 million in savings resulting from being able to use fiscal year 2018 funding to cover one-time costs for the mitigation of the agency's data center and contractor supportive transparency efforts, and to pay for some multi-year contracts to acquire data and to install new communication lines. The requested amount of funding would allow CBO to provide estimates and other analysis to Congress, such as more than 600 formal cost estimates and thousands of preliminary and formal cost estimates, about 80 analytical reports and papers, more than 100 scorekeeping tabulations, including account-level detail for individual appropriations acts at all stages of the legislative process, as well as summary tables showing the status of discretionary appropriations and running totals on a year-to-date basis. In closing, I would like to thank the committee for its longstanding support of CBO. That support has allowed CBO to provide budget and economic analysis that is timely, thoughtful, and nonpartisan as the Congress addresses issues of critical importance. Thank you.
Appreciate your testimony, Director Hall. In your testimony, you mentioned that last year CBO completed 740 cost estimates, formal cost estimates.
That's correct.
That's the highest number in a decade. I think you said that with the average completion time of 25 calendar days. How do you prioritize cost estimates?
Really, we look to committees. The basic logic is that legislation that's close to getting to the floor in a vote needs the most priority, and so we focus on the priorities of committees. We actually ask committees what their priorities are and look at their legislation. That's also consistent with how we were created. We were created to be responsive to the Budget Committee, Ways and Means, et cetera. So we very much are a committee-oriented organization, and this actually creates a lot of the frustration with us because we only have resources to work for committees. We don't work as much as we'd like for individual members. So that's sort of how we prioritize things, by literally talking to committees.
So if a member doesn't have the committee's endorsement to get something scored, how would they ever get a cost estimate of that legislation?
Well, if we've got time, we can do it. And in fact, that's actually part of what I hope we could do more of that if we have more resources. This is part of the responsiveness. But lots of times, individual members just have to wait. We literally will go back to a committee and ask the committee, if we're busy, ask the committee, should we make this a priority? Where should this be in our priorities? And sometimes we have to disappoint members.
Well, and I'm sure that happens a lot. I mean, there are thousands of bills that are, crisscrossing around here, some of which might be interesting to get a cost estimate of, but will maybe never even see the light of day, certainly never get a hearing, don't have many co-sponsors. But I do think that there needs to probably be a mechanism for members who have demonstrated that legislation has buoyancy in and of itself outside the committee process. We, for example, have a bill that has 322 co-sponsors. That's a lot.
Right.
That may be one of the most co-sponsored bills in Congress. Yet, when my staff exchanges with you on this legislation, essentially the office has stonewalled us, indicated they can't score it, and then just stop responding to requests to engage. So my own experiences outside of working directly with you, sir, and touring and meeting some of your very fine people, that's not a very good correspondent, a very good experience. And part of our job here is oversight to ensure that we're working on behalf of all the members and not just the Appropriations Committee or not just the Judiciary Committee. And so one of the things I think we're really going to need to look at is how we make the CBO responsive to initiatives for individual members who have demonstrated that legislation has buoyancy or has support. Maybe there's a threshold. Maybe, if someone brought you 435 co-sponsors, would that be enough? There ought to be some demonstration. Maybe if you have 100 people that have sponsored your legislation, it goes into another category. But I would think 322 would at least demonstrate the need for some acknowledgement that might be of value to have it's scored. The other problem with that is, in some cases, you need to have the cost estimate in order to move something through the committee process. So you sort of have a chicken and egg problem here. And I understand it's a resources-driven situation, but these loose ends create frustration for rank and file members.
Yeah, I appreciate that. And I hopefully we can figure a way out to prioritize more of that work. Maybe we can set aside a certain share of our time for just non-committee work, so we actually have some time carved aside, some things like that. That sort of thing is the sort of what we're sort of hoping to do with increasing our staff a little bit.
Do you think my team's interaction with the CBO in that experience is common, or is that a unique, inexplicable result? Do you find that surprising, or do you find that, yeah, that's sort of how it goes? We're inundated with so much stuff that we know there's a lot of loose ends and maybe not even return calls, et cetera?
I'm afraid it's somewhere in between. It's not absolutely unique. It does happen. It doesn't happen very often, but I know it's frustrating. For example, we should never stop responding. And I think members should always feel free to call me to get an explanation for where our priorities are, and we can talk about what we can. One of the things that's a little tricky for us is so much of our work is informal, and when it's informal and the committee asks us not to talk about it, for it to be confidential, I can't tell you what we're working on sometimes, other than assure you that we're busy, and that's kind of frustrating.
Well, I think it's to the benefit of Congress that the CBO is a viable and trusted entity. As Mr. Ryan noted in his comments, sometimes the results frustrate both sides of the aisle. That's to be expected. We have added additional transparency requirements in our 2018 report, which you referenced in your opening comments. Your thoughts and our ability to work with you, and if it's a resource, I know you mentioned resources as part of this, but to gain that trust, part of that is transparency, and the CBO's score is as good as bipartisan trust exists, right? And if one side isn't going to regard it as viable, then CBO starts to lose its effectiveness. So I encourage colleagues on my side of the aisle, and whoever's in the majority minority, to work with the CBO to make it more effective where they have concerns, to raise those with you and to make it more viable, because the CBO is necessary, I believe, in this process. Their cost estimate process is critical. So with that, Mr. Ryan.
Thank you, Mr. Chairman. So you mentioned you're going to hire more healthcare analysts in the next couple years. One of the longstanding discussions we had during the healthcare reform debate was about preventative healthcare. Right. We're going to get in the weeds a little bit here, because it was a frustrating thing for us to kind of deal with at the time, that there's an inability of CBO to account for savings through prevention in the healthcare system. Can you explain to me why that's an issue?
Sure, sure. It's not that we don't try. We really do look very carefully to see if there's some savings from preventative health care. One of the difficulties for us is having evidence of that, having really solid evidence that we've got something to lean on about how much impact the preventative health care has. And there's another side to it. I think it's easy to underestimate the cost of preventative health care sometimes. For example, if you provide additional health care to a large number of people and a small share of them really benefits, it's still a small share of the spending. And so that's one of the things that I think people don't often think about is a lot of preventative work doesn't actually make its way into better health care, even though it does for individuals. It doesn't necessarily for the entire spending. But we're serious about trying to look at that. We really do try to look for savings on that. There wasn't this year, but the year before, I think we've even used our blog post to talk about how we're limited in some preventative health care issues, and we'd love to see some research that would help us use that in our estimates.
What can we do to help?
Well, I think continue to make that a priority. You know, I think.
I mean, who do we need to contact? Do we need to coordinate this with HHS? Is there research institutions that are out there that we can engage with? I just think, I mean, moving forward, regardless of where you stand on healthcare, I mean, we should know as a country how much we're going to save if we have a robust preventative program regime established for our citizens. I mean, how can we possibly move forward with healthcare reform, whether you want to do their side or our side or whoever side? Who can we help you engage with?
Well, I think certainly talking to HHS and talking to individual researchers that this is a priority, because so often we're left with really just no evidence on what the effects of some preventative health care will be.
I mean, that's just mind-boggling to me. I'm not trying to be a jerk, but I'm just, you know, how are we in 2018 in the United States of America and we can't figure out how much savings we can garner from making sure people have preventative health care? You know, given Medicare and Medicaid and what we know about screenings, I think we need to make this a priority, because moving forward, healthcare is going to continue to be an issue. So I made my point. A follow-up question would be, are there any other areas of our economy, programming, that you feel somewhat the same frustration in your analysis, and that your analysts may feel? There
are lots of areas. One of the bigger ones, it comes up almost every time we have our budget and economic outlook that we produced last week, is we continue to sort of adjust the cost of health care, of Medicaid in particular. We keep overestimating the cost of it. It keeps coming down, and the big problem is we don't know why. And so it's hard to change our forecast if we don't know why it's coming down. It's just coming down. So we actually are trying very hard.
Medicare, Medicaid?
Medicaid.
Medicaid.
Medicaid in particular. But that, you know, that's a big part of the budget, and we hate to see ourselves overestimate the cost, you know, more than once or twice, because we'd like to sort of get a better estimate, and we're handicapped because there just isn't any evidence of why that's happening. So that's one of the things we're trying to prioritize. It's an example, I think, of what you're talking about.
Mr. Chairman, maybe there's an opportunity for us to sit down with the money we spend at NIH and some of these research institutions. Then Department of Defense spends a lot of money on research, private university. I mean, it's just, you know, the corporate spend a lot of money on research. Maybe there's a way for us to coordinate this so that we can just have a better understanding of what's working, what's not working. I'm the first to say, if there's something that we're pushing that's not working, we should stop doing it. But we got to base that on some good information.
Well, we'd be happy to sit with you and talk a little bit about some priorities. We can certainly tell you where we feel like we would like some help, extra help in terms of research that would help us more accurately score things like preventative health care.
Okay. Follow up on that. Thank you, Mr. Chairman.
Good.
Mr. Taylor?
Thank you, Mr. Chairman. Thanks for being here. Appreciate it. I know you don't have an easy job, and like Congressman Ryan said, he does on both sides sometimes, you know. CBO you guys routinely look, sorry. Is that on? Yeah. Do you routinely look back at previous estimates and compare those to actual outcomes? If so, what's your internal process for reevaluating those estimate models? And then how do you incorporate your findings going forward?
Sure. Well, we do it in a big sense. Every couple of years, we look at our economic forecast. Has our forecast gone? We've also now completed recently a report on how accurate our overall forecast on outlays has been, and then also revenues has been. So we get this big picture of what's the average error from our baseline. We're also starting to pick out particular bills and start to look back and sort of see how we did on those. We're always going to have a limitation because so often a change in legislation is part of a bigger budget category, and it's very hard to isolate the effect of that change in the legislation. But we're starting to do that more when we can. For example, we just did it with our estimate of the ACA. We just took a really hard look about how well we did on that forecasting, and we actually made a presentation at CRS on it. But we do have some information on that. We're trying to do that more and more. And as part of our routine, it doesn't become public, but every year we go through all our budget categories and talk with the analysts and see how they did that year, how their budget category did. Was it up too high, too low? And we talk about that, and that's actually part of their evaluation. And then we'll discuss their modeling if they need to adjust things like that.
On that note, for modeling methodologies, do you also, is that just an internal process, or do you reach out to like academia and other financial researchers that are experts to sort of have an independent evaluation to make sure that you guys are on track?
Well, we use those folks routinely for almost anything we do, and anytime we do research reports and such, we reach out and have them review things and get feedback that way. And when we did those larger studies about how accurate have we been in forecasting revenues, for example, we have that reviewed by outside folks who have some expertise. So we try to engage in that way. We have a panel of economic advisors that we meets every couple of years. And we routinely throw important topics in front of them. We also have a panel of healthcare advisors. So, for example, we were concerned about our estimate of the effects of the individual mandate. Well, last fall we made a presentation to our advisors and got comments and got some input as to whether they thought we were being accurate or not.
What happens if you're inaccurate, or when you look back and there's when your cost estimates are widely off? Not because of, perhaps obviously there's different budget things and other things that happen. What if you got it really wrong? Like, who do you communicate that to? Do you talk to members of Congress? Do you talk to folks and like, hey, look, we really got this wrong and this is why?
Well, we're certainly willing to do that. We don't have a formal process for doing that. Our first notion is to try to fix what we're doing so we get it correct. I'd tell you one of the things we're going to do that maybe fits into that category. I mentioned that once a year we go through all our budget categories and do an analysis of how we did. It's something we call the analysis of actuals. We're actually going to start making that public every year. So you can actually just look at how we did by budget category at the end, in 2017, and sort of see how we did by budget category by category. Give you some feedback that way about how we're doing.
And then for your average time, was it 25 days, I guess? Right. What's your goal? And then if you are not meeting that goal, why and what are you doing to make the goal?
Well, the tricky part is different pieces of legislation have wildly different complexity and time frames. Basically, our process has us doing what I sort of feel like is due diligence, where we spend some time looking at the legislation carefully, talking with folks who understand exactly how the legislation is going to work, and that's a big part of the cost estimate. We reach out to experts, we reach out to the administration folks who are going to be implementing it. So we have this process where we're working hard to get comfortable with what we think the impact will be. And then it's this judgment call that, well, okay, we've done enough work, time to write it up and send it out. So it's this little process, and sometimes the time frames are really short. We get really rushed, and we still try to maintain a certain level of quality, but sometimes it's harder to do than others when we're pressed for time.
Thank you. Thank you.
Ms. McCollum.
Thank you, Mr. Chair. As Ranking Member Ryan said, healthcare will be in your future. I'm going to go back to healthcare. So I think there are places out there we can look at prevention. Maybe makes it hard for you to score in a very large bill, but I think figuring out a way to break it down, I would cite the Mayo Clinic, for example, with all of its research over the years. The CDC, I mean, the CDC knows if you have a flu shot, you have fewer emergency room trips, which not only, and insurance companies have figured that out too. So, I mean, there are some preventative interventions out there that are well known, and diabetes is starting to become on an up ramp where we're having more and more success in figuring out what to do with that. I'm going to take this to the Indian Health Service and maybe figure out if this is a place where we can start, the chairman and I, long, and it's nonpartisan on the committee, as the other members of the appropriation knows the way that we work on this. So I'll just give you a snapshot. So Indian Healthcare Hospital is going to be 40 years old. Any other hospital without having, would have had revisions or things done to it within the last 10 years. An Indian Healthcare Hospital is going to maybe have an old, and I've seen them, an old X-ray machine. Any other hospital might, depending upon how old it is, would have a CAT scan. An Indian Healthcare Hospital might not, or clinic might not be very well connected to the internet where it could provide telemedicine. Rural hospitals have found that if they're going to survive and really do quality patient care, they have to have telemedicine available to them. So you start out with all those inequities, and then you start looking at the outcomes that Indian Healthcare Service has. Then you look on top of that, if you just graduate from medical school, are you going to go to the 40-year-old hospital that has the old X-ray machine? So then you start having problems retaining doctors, nurses, nurse practitioners, PAs, technicians. It just goes on and on and on. Now here's where we know it affects our budget. Someone on an Indian reservation, Mr. Stewart, had some great examples. Sustains a head injury. Coming to the clinic, well, we don't have anything to look at that head injury. What are we going to do? We have to call air transport in to transport you out to get an X-ray or to have the right machine do the scan, and maybe you need no further intervention. Oh, and now you have to come back. So I think there are some things out there if we want to try to look at small bites to work together on that, on it, because we have treaty and trust responsibilities to get this right, and we're totally failing. And now we're having hospitals that are falling out of compliance, which means we can't be reimbursed when we have patients there. So it's we're seeing that cycle before our eyes now that we finally started bipartisanly, nonpartisanly collecting information, working with the tribal communities on this. Another area where there's clear health care disparities is in maternal child health among minority populations, whether it's urban or rural. And we know what the outcomes are for hospitalization. We know what the outcomes are for low birth weight and everything else that's in there. So I think, to Mr. Ryan's point, and I think there are a group of us, just let's not get into whether it's single health care, the Affordable Care Act, Obamacare, Ryan Care, Trump Care, whatever you want to call it. I think some of us need to just start saying that we have a responsibility of using information that's in front of us on healthcare to lower costs. Is it a lower cost for Medicaid, Medicare? It'll lower cost for Indian Health Service. It'll lower cost for the DOD. It'll lower cost for the VA. And that means that we start reaching better parity. If someone wanted to put a group together to talk to you about how we would narrow the silo down so that we could look at it, to the chairman's point, trying to get a reporter to get you to work on something through no fault of your own, you're overworked, is very difficult. What would be your recommendation to those of us on the Appropriations Committee and Energy and Commerce in a nonpartisan way is working on this too, especially with Indian Health Service?
Well, I think certainly expressing the interest to us, and one of the things I think we should try to do a lot better, and that's just when you have an interest in talking about one of these topics, we can send folks in and just talk with you about it, how we think about the effects of some of these things, how we think we might approach it. One of the things that we wind up doing, again, it's too much for committees, but so much of our time is spent in this sort of technical assistance. We're helping committees think through the possible legislation, draft pieces of legislation. I think that's really important, and this is the sort of thing I think could help individual members more if we did more of that, where we could come in and talk to you about.
So one of the things that we ran into, and it's a term called dynamic scoring.
Right.
So when we do have some of these preventions that we know will save money, we weren't allowed to do it because we were told there were prohibitions on dynamic scoring. Is that correct on healthcare?
No. In fact, we're directed to use dynamic scoring for any piece of legislation that's significantly large. And then we're required to do it whenever one of the budget committee chairs asks us to do it, to the degree it's possible.
So the tax bill was dynamically scored, I understand. And
Right.
so if someone had a piece of healthcare legislation, it could be dynamically scored, is what you're telling me.
That's right. Now, the tricky thing for us would be that the dynamic scoring really makes a difference when it's a big piece of legislation. When it's smaller, there can be some dynamic effects, but they're much harder to estimate. But we're willing to look at it and talk about that. But we're not constrained on the dynamic scoring. In fact, I kind of wish we were used a little bit more
Well,
for
the
the
tax
dynamic.
bill was pretty big, so I think I can come up with a piece of legislation smaller than that, Mr. Chair. Thank you.
Thank you, Ms. McCollum. Director Hall, thank you for your appearance today. We'll continue to work with you, of course, as we put together the pieces of the 2019 budget puzzle. Subcommittee stands in recess until April 25th at 1 p.m., at which time we will receive testimony from the Government Accountability Office. Meeting adjourned.